Jillian Gilchrest, State Representative from the 18th in West Hartford, and I am the co-chair of the Human Services Committee. A lot top of mind based on this conversation, and so thank you all for sharing and for bringing us together. The first is, a lot of people have mentioned the pandemic and COVID, and I feel that same kind of panic and overwhelming feeling we had during the pandemic, and the unfortunate piece is that it's the federal government doing it to us this time. And my hope was, out of the pandemic, that we would recognize the importance of government and the important role government plays, in particular with regards to public health. And so I won't lose hope in that. I think many of us recognize that, even in these difficult times. You've asked a lot about racial disparities, and DEI came up, and people have advised me, and I think it's important to not say DEI, but to say what it means, which is diversity, equity, and inclusion. And so the elimination of that, I think, is a direct example of how this administration doesn't care about racial disparity. And so, unfortunately, I do think we're going to see increases in racial disparities during this time. I also think there's a lot of projection from this federal administration going on. So there's a lot of talk about abuse and fraud when it comes to our social service system, and that's where I think the projection is coming, because certainly being a legislator now, I'm in my 7th year, and I've done advocacy for quite a while in the state of Connecticut. Certainly there will always be people who take advantage or break a law. So the example I give is texting and driving, right? Yes, we don't want people to do that. We have a law that says they won't. People do. When it comes to certain populations, and I'll speak to, having done reproductive health is a perfect example, but also now being chair of Human Services, I see it when we talk about low-income individuals. There is this demonizing that goes on as if they are taking advantage at a level no one else does. And I think all of you who work with folks with lower incomes know that they're just trying their best to get along. And work was brought up by End Hunger Connecticut, and certainly we are hearing, so the work requirement, I guess it wouldn't be a work requirement, but the fact that you're saying folks would need to prove their income, which is ludicrous, right? For folks to have, you'd have to have all that documentation for people to be able to access food in schools. And then we see that same type of policy when we're discussing Medicaid. At the federal government, when there's been a lot of back and forth of what might happen with Medicaid cuts, but one of the policies that seems to keep rising to the top is, well, of course people should have to work. And to me that's this demonizing, because most people do work who receive Medicaid. So why don't we take a moment to discuss what's really going on in this country, which is a majority of working Americans aren't paid a living wage. A majority of Americans have a job that doesn't offer them health care. A majority of these individuals who receive Medicaid are working 2 and 3 jobs. And so for them to take I don't even know how much time, because I don't like paying my bills monthly. I do, but that's my least favorite thing. Right. We have a report around here we have to do. I avoid it till the very end because I don't like that type of stuff. But I have one job, right? If someone is working 2, 3 jobs, has children, now they've got to find the paperwork and submit that to the school just so their kid can get food. That's insane. And I think those running this country right now wouldn't want to do that, and they have someone who can do it for them. So maybe they don't understand how hard that is. So the other piece, I think, is to break down these myths and misinformation. And so in the state of Connecticut, you already mentioned it, nearly a million individuals receive their health care and social services through Medicaid. 40% of Connecticut's state spend on Medicaid is for aging individuals and those with disabilities. So that, 40% of our spend. And then, like I said, when we're talking about the rest, these are folks trying their best to get along in a state that is high cost, with not a lot of health care options, and so we offer Medicaid. I will say that here in the state, and thank you to the comment, we're going to be trying our best. We did put out an appropriations budget. I will continue to say publicly, and we'll be pushing until the end of this legislative session, the amount we put in to increase Medicaid rates is half what I want, and I will be pushing for the full $30 million is what I'd like to see us invest this year, fiscal year 26, because we need to get those rates up. You have heard there are programs that are closing. Because Medicaid here, the rate issue is a two-pronged issue. It's a workforce issue. Again, Connecticut is actually contributing to the working poor through our Medicaid rates and our nonprofit rates, and it's an access issue. And so if we can at least get those rates up at the same time that the federal government's going to do what the federal government's going to do, we can at least get providers in a better place than they'll be if we keep them at this low bar and that hit comes. So that's my goal. We anticipate that the legislature will be back based on what the federal government does, and we're all ready to do that because that's what this role is for.